We discussed about obstructive sleep apnea, but you might say, Doc, I never snore at night. So, is snoring a must in obstructive sleep apnea? No. So, if especially a woman, and sometimes in males, they might not have obvious snoring. But if you have other symptoms such as a sore throat or a dry mouth in the morning, restless legs, and findings on your smart watches, it's best talk to your GP because slight changes in lifestyle can do a significant change in your outcome, especially with obstructive sleep apnea. So don't just let it go. Just maybe talk to your family doctor during your next visit, and it could make a whole big deal, a big difference in your life. Till next time, ciao.